You're listening to Health Professional Radio. My name is Wayne Buckler, and today my guest is Carol Bryant, the CEO of Macquarie University Hospital, which is Australia's only private university hospital. Carol, welcome to Health Professional Radio.
Well, thank you very much, Wayne.
Now, Carol, I have a confession to make. I didn't realise Macquarie University was involved in a hospital, so tell us a little bit about the facility.
Well, the hospital is actually 5 years old. Was opened in 2010. And the purpose of our facility was to, in the bigger strategic plan of the university, to bring medicine onto the campus. So the university is very involved in allied health professions, speech pathology, audiology, etc., but really wanted to move into medicine. And so the purpose of it is for us to support that endeavour. So we're a complex surgical hospital. We are a private not-for-profit, and we are here, and the grand vision is to develop Australia's first academic health sciences centre.
A splendid ambition, I have to say. Now, you're located in Sydney on the university's campus, are you?
Yes, that's correct. We're on right on the corner of the campus. It's really a health precinct now. We've grown over time. We've brought in a doctor in that 5 years. We've brought in a doctor of physiotherapy. We've done training up to date, which is post specialist training. So doctors who are already specialised have been doing their subspecialty training. For example, a neurosurgeon might come here and specialise in spine. So, but the university moved from a school of medicine to a faculty of medicine 2 years ago. And in that, we're now broadening our horizon to look at teaching in, potentially the undergraduate space. So certainly we're looking at a Bachelor of Health Sciences and who knows what the future will bring, but certainly expanding in that area of teaching in medicine.
Now, recently I was talking with Queensland Health, and they're announcing that they're going to have a digital hospital soon, but I understand you're already a full digital hospital.
Yes. In fact, that was our plan from the beginning, and so yes, we have a full end-to-end electronic medical record, and we're expanding that at the moment to go into our clinics. So where our doctors are seeing patients over the next 18 months or so, the clinics will also have that. So if a patient comes in to see a doctor, before they know they need surgery, that record will be integrated into the complete medical record within the hospital. So yes, it's a very exciting and very innovative place to be.
And I imagine that with a fully integrated electronic health record like that, there are both savings and learnings to be made.
Yes, absolutely. There's no doubt about that. And we're lucky to be associated with the Australian Institute of Health Innovation. And they were brought across to us from one of the other universities about a year ago. And we're working with them really to research that whole, if you like, the whole EMR. What difference does it make? How does it help with governance? How does it reduce medication errors, et cetera, et cetera? It's pretty... I guess being on a university campus, what we're doing in the Academic Health Sciences Centre is pulling together research, teaching and clinical excellence. So it's an opportunity not done before in Australia, and very exciting to be part of it.
It sounds exciting, and it does sound like it's custom built to bring about both good patient outcomes and good clinician outcomes by the sound of it.
Absolutely, and we know from the research that one of obviously the focus of creating an academic health sciences centre is the patient journey. And when we bring those three areas together, we know that the research shows that the patient outcomes are better. And in fact, the other thing is that it attracts more good clinicians, more good nurses, good people to come to a centre where they see these outcomes actually going to come into fruition.
Now, Carol, Macquarie University Hospital has also been at the leading edge with some other technologies, I understand, with gamma knife and cyclotrons and things. Tell us about some of those technological advances.
Yeah, so the gamma knife is also first in Australia. We do talk about a lot of firsts here at Macquarie University Hospital. And it's not new technology. So up front, it's been around since the 1960s and is used extensively throughout the world. So what it does basically is it treats brain secondary cancers. So you might have cancer, say, in breast or melanoma, and you get a secondary cancer in the brain. and it treats those cancers without a surgical incision. So anything from your cervical spine up, and can treat multiple tumours. So it's a complex, coordinated multidisciplinary team. So you have a neurosurgeon, a radiation oncologist, a physicist, a radiographer, a nurse, all working together, planning this treatment. And the patient basically lies on a bed with a fixed frame, and there are 192 beams of cobalt pointing with sub-millimetre accuracy to various tumours, but not affecting the rest of the brain. So it's extraordinary treatment.
It is remarkable, isn't it?
It is very remarkable. And you know, the other thing is we do robotic surgery here, and you've probably heard of robotic surgery for prostate cancer, but we also do robotic surgery for gynecological cancer, but we're doing transoral cancer for transoral treatment for head and neck cancer. Also, we're moving into using the robot for liver cancer. So really, you know, it's a demonstration of, yes, this is working elsewhere, but we take it to another level. And I guess the other key is that we have multidisciplinary teams that really look at, this is you coming in to have treatment, what's the best place for you to go? What treatment do you need? And we offer a broad spectrum of treatment, really focused on you know, creating a great journey and outcome for the patient.
You're listening to Health Professional Radio. My name is Wayne Buckler, and my guest this morning is Carol Bryant from Macquarie University Hospital. Carol's the CEO, and she's been telling us about some of the technology that's available at Macquarie University Hospital. And Carol, I understand that imaging is, of course, critically important in patient care, but I understand you've taken it to world class.
Yes, the medical imaging department is certainly you know, fits in with the overall vision of the facility, high technology, you know, specialised care. And so, you know, we have the ability to merge various modalities. So you can have an MRI, a PET scan and a CT, and that can be merged to give the clinician a really clear view of say, cancer treatment, that you might have to look at one after the other and have the treatments done on different days. So we've got subspecialised radiologists here who might only do musculoskeletal, they might only do neurosurgery, or so very subspecialised, both equipment and personnel, to really assist in accurate treatment for patients where specialists have referred them to this group.
That's an extraordinary approach. Carol, as a private hospital, does this make you more expensive than other private hospitals?
No, the patients obviously pay. It's the same as any private facility where private health insurance is required, and if you went to any other facility, your private health insurance would cover you here as it would anywhere else.
That's an extraordinary achievement, being able to put together a private facility that's able to be both on the leading edge of research and technology, and do it in a way that's price competitive with the normal private hospital.
Yes, it is extraordinary, and I think the real difference is that that the university in their in their strategy really wanted to bring medicine onto this campus and thought, what's the best way to do it? And so while we're only young, and this is in the very beginnings of this mission and vision that we have, Heal, Learn, Discover is what we describe as our purpose. I think it has all the elements to really make a difference, to really improve patient lives and give them better outcomes.
We have on Health Professional Radio previously interviewed some of your clinicians and academics, and it's always interesting to hear about their research. Carol, my favourite question, what's the biggest misconception amongst your customers, clients, patients, clinicians, researchers that drives you nuts and keeps you awake at night?
Well, I think I'd probably say that the biggest frustration is that people don't really understand what we're here for, that we are a point of difference, that we're trying to create something that doesn't exist in Australia. So it's a bit like anybody who's on the leading edge of something new. There are sort of the naysayers and the, oh my goodness, I had no idea, or, so I guess that's the frustration. We really, as we build this enterprise, we really want people to know truly why we're here. And it is, as I said, Heal, Learn, Discover is our mission, and we really want to make a difference in patients' lives.
Well, let's hope today, Carol, we've been able to share that mission with a few more people in the clinical community. Thank you for your time. I realise you're very busy, and I do appreciate you giving up your time to us today. Carol Bryant's the CEO of Macquarie University Hospital, and I do thank you for being with us, Carol.
That's my pleasure.
If you just missed my conversation with Carol, then you've just missed a great insight into Macquarie University Hospital. However, the good news is, being a radio station, we have a recording of it. Yes, you can listen to a full archive on SoundCloud and on YouTube. We also have a transcript of this interview on our website at www.hpr.fm. The best URL to get in touch with Macquarie University Hospital is www.muh.org.au. My name is Wayne Buckler. This is Health Professional Radio.